I'm a parent that's just sent one of my children back to school today. The big question that I think a lot of people are asking in the UK, a lot of people, certainly from parents to governments to teachers, are asking, is this a good move? Is this a safe move? Is the UK moving too quickly in your mind?
Those are several good questions. I think things won't be safe until the vaccine is out, but there is not a huge risk to sending children back at this time if a child can be tested, if they become symptomatic after going back to school, and there's contact tracing to find out all of the children that child has been in contact with so that they can be isolated. So the rate of infection in children, as you know, for whatever reason, is lower than in adults. And we don't understand this. It may just be that children have such mild disease that they never seek medical attention and aren't tested. But the rates that are published suggest that there isn't widespread infection in children, so that if schools open, the risk of an infected child, even one who has virtually no symptoms, is in a classroom, is fairly small.
Okay, so it's not going to have a meaningful impact on the R number. Would you therefore think that this is something that can be followed up with more children going back? What would be the impact on the R, which critically has to stay below 1? The rate of infection has to stay below 1. If we were to send more children back, do you think this is something that the UK would be okay to do? Like, I understand the necessity for a phased kind of roll back into school, but is this something you think that actually could be rolled out on a more wider age group basis?
So the question of infectivity and contagiousness, the R, is one for which we have virtually no information in children, especially in a classroom situation. So it is an unknown. I have brilliant infectious disease colleagues in England, and you have a wonderful public health system. So any child that goes back to a classroom situation who ends up becoming infected during this next 2 to 4 weeks should be identified, because PCR testing for an active infection is widely available. So the R will be determined in this grand experiment in England that we are all watching very carefully from the United States to see if spread through the classroom with restrictions that I know some of your schools will be having, whether the spread will be significant or whether there will be no spread.
Yeah, it's going to be fascinating. So they're all in bubbles, and if one child comes down with symptoms, the bubble bursts. All those children are then isolated while that child is tested. Dr. Bradley, the longer-term question that I think a lot of people are trying to figure out as well is, what is the impact on longer-term health outcomes, do you think, as a result of what is happening here? Is it better to focus on what is happening here in the short term and make sure that the R stays low? Or do we need to worry actually about the longer-term health outcomes if children spend longer and longer away from school? Because that may have an impact on their life outcomes, their ability to earn money, and that has quite a high link as well with long-term health.
A great question, and I want to differentiate the issues, the social issues and developmental issues from the acute infection and what we call morbidity and mortality, how many people get sick. Children do very well with this infection, and if there is infection in the classroom, it will probably be mild. It will probably be picked up early. But those children who pick it up in the classroom will bring it home to their parents and their grandparents. And the grandparents, of course, are at highest risk of serious infection and death. So the children are sort of the tip of the iceberg. And I'm not so worried about the children. I'm much more worried about their parents and grandparents and other people with serious underlying disease that they come in contact with. So for parents whose kids are going to school, now, today, any symptoms, any respiratory symptoms, sore throat, headache, fever, they need to take their children to get tested immediately, even with mild symptoms, because children tend to not have serious disease, and kids will be playing as though nothing's wrong, but they will have symptoms. And so parents need to be vigilant and take their kids in for testing. Now, social development, of course, is important, and we all in the world at this point believe that saving lives of the grandparents is worth holding off on the social development of kids, who we believe will catch up once the restrictions are lifted and children can get back to normal environments for learning, promotion of health.
Yeah.
So it's the equation is the risk to the elderly.
So, Dr. Bradley, for me, I have a 5-year-old daughter who is at home, and obviously the U.S. schools, at least in New York, have not reopened. So as we look towards the U.K. to see if what they did worked, what's the lag time? When are we going to know if what they're doing is working for us and we should try it?
I'm looking exactly like you are, Alex. The incubation period, of course, depends on how close you are with someone and how much virus you get on you. So with children, assuming that if you turn your head, they will be playing with each other and hugging each other and sharing food, which they shouldn't be doing. But that kind of behavior will lead to increased spread of virus, and that's what we're looking for. So for your 5-year-old who's going to school, we're going to look at the situations in the UK where virus is spread, situations in the UK where school rooms the virus doesn't spread, and we'll learn from that. We're putting together policies right now for our schools, which should open end of August and September. And you're right, the experiment is happening in England right now.
Mm-hmm. I wish my daughter was at school. And this is really pivoting off of Guy for the long-term consequences, but anecdotally I was hearing of some private schools that are considering reopening where they have 12 kids in a classroom, 2 teachers, they're all in basically a pod, they stay with them the whole day. Great for a private school when you pay $60 grand a year. Public schools aren't going to have that ability. Is this just going to, what's the implication of this? When we have different tiers of how schools reopen and the health of kids as that trickles down into how they learn, where they learn, how much money everyone has?
You've identified social issues that I, as an infectious disease doctor, have very little control over, but absolutely the better the social distancing, the farther the distance between desks, the more partitions you can place, the less contact, the less sharing of food that kids usually do, the less the virus will have a chance to spread. So you're absolutely right. We expect that in school situations where there's less put into distancing, there is a greater risk of spread. And I wish that weren't so, but you're absolutely right. But again, for the kids, they'll actually do okay. And in the United States, we do have the ability to test if a child's symptomatic in virtually every corner of the country right now. So early testing with tracing by public health officials is going to be the key, whether your child goes to a community school or a private school. Parents need to be vigilant and take their kids to a healthcare practitioner for anything.
So basically, they're in these bubbles. If one of them gets it, the bubble bursts, they get tested, they figure out what is happening. So that kind of protects the rest of the school. Doctor, I went through my son's timetable this morning. Every other line was wash your hands. Is that still the best thing we can do to protect our children? What can be done in schools to make sure that we limit the spread of the virus at the school? They are going to socially distance. They are going to be put into pods that are going to limit the exposure. What can be done in your mind that parents can think about as they send their children back to school to help protect them?
Well, washing hands is certainly good, but but what we call cough etiquette and sneeze etiquette, where you contain your secretions, you can't do that for children. You put masks on and they'll come off in just a few minutes. So you could tell the children to do anything, but you're fooling yourself that the children will actually follow the social distancing guidelines that we have in place for adults. And that's why we worry. Children are children, and we can ask for them to do all of the measures that we have the adults do, and their minds are somewhere else. They just won't follow through. They're not being bad. They just forget. So I think that the distance between the desks and the farther you can get, 3 to 6 feet, and plexiglass partitions, perhaps anything that will prevent the spread of secretions when a child coughs or sneezes. That's number one. If they get secretions, infectious secretions on their hands, and they touch surfaces, both washing their hands and having school personnel wipe down surfaces so that if there's infectious secretions on a toy or a pencil that's shared or pen or computer, that if it's wiped down with wipes that will kill the virus, then that will also limit transmission.